Bismillahirrahmanirrahim. Today my topic of presentation is HIV. HIV or AIDS, which is a human immunodeficiency virus. Quote of the day is: all your dreams can come true if you have courage to pursue them. Learning outline of today's presentation is introduction, epidemiological triad, chain of transmission, levels of prevention, and recent advances. Learning outcome. At the end of this presentation, participants will be able to describe the epidemiological triad, prevention aspects, and recent advances. World AIDS Day is celebrated globally on December 1, 1st December. Case presentation. A 47 years old woman presented with chief complaint of fever, 103 degree Fahrenheit, headache, fatigue, aching muscle or joint pain, tiredness, night sweats, skin rash and ulcer in the mouth, swollen glands, nausea and vomiting which is last for 2 to 6 weeks. She has anorexia and lost 70 pounds weight over last 3 months. She used heroin and cocaine IV intravenously for 6-month period 6 years ago. She does not smoke or drink and has no past history of sexually transmitted disease but is sexually active. She has no known allergy of any drug allergies. On physical examination, she was pale, diaphoretic, and in acute respiratory distress. On examination, oral thrush was present, and examination of lung disclosed poor inspiratory effort and bibasilar cracks on upper two-thirds of the posterior lung field. She had tachycardia with no murmur. Her abdomen was non-tender and there was no enlargement of liver or spleen. Pelvic examination was normal except for vaginal candidiasis, and neurological examination was normal. On laboratory evaluation, HB was 10.8, W cell count was 7500 millimeter cubic millimeter, and platelet is 248 cubic millimeter, and CD4 cell count is 235 millimeter cube, and HIV or RNA level is 234,000 copies per ml. The most likely diagnosis of this woman is HIV or AIDS, as the woman is IV drug abuser and cocaine, and all these symptoms represents the HIV or AIDS. Now HIV or AIDS. Symptoms of HIV infection. There is severe headache, swollen lymph nodes, ulcers in the mouth, spleen and liver enlargement, muscle aches, joint pain, nausea, vomiting, diarrhea, and body rash, which is in acute infection lasts for 2 to 4 weeks. Now, what is AIDS or HIV? AIDS or acquired immunodeficiency syndrome is chronic, potentially life-threatening condition caused by human immunodeficiency virus, which can actually damage the immune system, and it interferes with body ability to fight infection and disease, and it is actually the sexually transmitted disease. According to WHO, recent figures, the HIV continues to be major public health issue, and it claims 36.3 million people live so far with the globally with HIV. And there is no cure for HIV infection. However, with increasing access to effective HIV prevention, diagnosis, and treatment, which include opportunistic infection, it is now become a manageable chronic health condition. But there is no cure, and there was estimated 37.7 million people living with HIV by the end of 2020. And to reach the new proposed global goal, the WHO present 95 targets set by UNAIDS, which will need to effort to avoid the worst case scenario of 7.7 million HIV treated deaths over the next 10 years. Origin. The scientists identified a chimpanzee in West Africa as a source of HIV infection in humans. This is the earliest known case of infection with HIV-1 in human, which was detected in blood sample collected in 1959 from a man at the Democratic Republic of Congo. If we see the epidemic types of HIV, there is low level of epidemic, concentrated epidemic, or generalized HIV epidemics. What is a generalized epidemic? If the HIV prevalence among general population is more than 1%, then it is known as generalized epidemic. And if HIV population among high risk groups more than 5%, it is known as concentrated epidemic. And low level of epidemic is HIV prevalence among high risk group below 5% and among general population below 1%. Pakistan, if we see the stats of 2020 recent stat, the HIV and AIDS estimate among adults and children living with HIV is 200,000, and adult age 15 to 49 HIV prevalence rate is 0.2%, and women age 15 to 49 HIV prevalence is less than 0.1%, and if you see men, prevalence is 0.2%. Epidemiological triad, agent, host, or environment. Agent is human immunodeficiency virus, which belongs to retrovirus family. Subgroup lentivirus, it is RNA virus which replicates in actively dividing T4 lymphocytes. Its unique ability to destroy helper T cells, and it mutates rapidly. It is rapidly killed by heat, 20% ether, acetone, alcohol, but it is resistant to ionizing agents and UV light. If we see the classification of HIV, types of HIV, then there is two types of HIV. HIV1, which is further divided into group B, group O, group N, or group M, belong to various territories, the world. And HIV2, which is further divided into group A to H, which belong from Africa, Brazil, Europe, or US. But if we see the most prevalent area of HIV is seen in sub-Saharan or African origin, East and Central Africa. Reservoir infection is the cases and carriers of HIV infection. And host factor include age. All ages are susceptible. Most common is 20 to 49 years of age. Both genders are susceptible. High risk group include intravenous drug abusers, which receive unsafe injections, blood transfusion, medical procedures that involve unsterile cutting or piercing, male homosexuals and bisexual, heterosexual partners experience accidental needle stick injury, including health workers. Mode of transmission, it is actually transmitted through fluids, and most common is sexually transmitted. Then blood transmission, contact is highly contagious. It can also spread from maternal to child transmission. As we see that it can be spread through unprotected sexual intercourse, passed from mother to baby, also passed through sharing injecting equipment, and contaminated blood transfusion and organ transplant. But we cannot get HIV from kissing, hugging, sharing food, insect bites, for example, mosquito and insect bite, toilet seats, bathing, sneezing, and coughs, and from sweating. If we see the stages of HIV, according to CDC, there is 3 stages of HIV. First stage is the acute HIV infection, which people large amount of have this type of infection, this type of stage. It is very contagious, and in this stage, people have flu-like symptoms, and the body is their body naturally responds to infection. But some people may not feel sick at this stage, and in this flu-like symptom, there is body ache, joint pain, muscles, swollen muscles, pains in the body, high grade fever, and swollen lymph nodes. Then come the stage 2, which is chronic HIV infection. This is also called asymptomatic stage or clinical latency stage. In this, HIV is still active but reproduced at very low level. People may not have any symptom or get sick during this phase. Without taking HIV medicine, this period may last a decade or longer, but sometimes may progress faster. People can transmit HIV in this phase, and at the end of this phase, the amount of HIV in the blood, which is called viral load, goes up and the CD4 cell counts down. The person may have symptoms as the virus level increase in the body. People who take HIV medicine as prescribed may never go into stage 3 if they take medicine at stage 2. Stage 3 comes the acquired immunodeficiency syndrome, or stage 3. It is the most severe phase of HIV infection. In this, people with AIDS have badly damaged immune system, and they get increasingly number of severe illnesses, associated organ infection, and called opportunistic infection. And people receive an AIDS diagnosis when the CD4 cell count is less than or below 200 cell millimeter cube. When people with AIDS have a high viral load and very infectious. Complication. Infection related to HIV/AIDS is associated with pneumocystis and pneumocystitis pneumonia, which is a fungal infection, can cause severe illness in the lungs, and it includes the most common type of pneumonia in the HIV patient. It will include non-productive cough, fever, dyspnea, There is also yeast infection or candida infection, which is the most common, and it causes inflammation or coating of the mouth, tongue, esophagus, or vagina. The patient feel difficulty in swelling, anorexia, weight loss. TB is also most common opportunistic infection with HIV worldwide. TB is the leading cause of death among people with AIDS. CMV or cytomegalovirus is also most common herpes virus, which is transmitted in body fluids such as saliva, blood, urine, semen, and breast milk. And healthy immune system inactivates the virus and it remains dormant in your body. But if the immune system weakens, the virus resurfaces and causing damage to eyes, digestive tract, lungs, or organs. Another infection which is associated with AIDS is the cryptococcal meningitis, which is the inflammation of membranes and fluids covering the brain and spinal cord. Toxoplasmosis is also another leading deadly infection which is caused by Toxoplasma gonadei, a parasite which is primarily transmitted by cats. Complication or cancer related to HIV, most common is lymphoma. This cancer starts in the white blood cell and the most common early sign is painless swelling of lymph node. Kaposi sarcoma, which is usually appear at pink, red or purple layer on the skin and mouth. HPV or human papilloma virus related infection which include anal, oral and cervical cancer. Other complications include wasting syndrome, in which untreated HIV or AIDS can cause significant weight loss accompanied by diarrhea, chronic weakness, and fever. There is also neurological symptoms such as confusion, forgetfulness, depression, and anxiety, difficult walking, and HIV-associated neurocognitive changes can also occur. Kidney disease can occur because there is inflammation of tiny filters in the kidney that remove extra fluid and waste from your body and pass through them to your urine. There is also liver disease, which is a major complication in people who have hepatitis B and C. HIV infection and pregnancy and breastfeeding. Only in CDC recommend to prevent HIV infection, and it is recommended that mother living with HIV not breastfeed their infant because HIV is a virus that attacks body immune system that is spread through stained body fluids, including breast milk. Therefore, the safest way for the mother living with HIV to feed her infant is to prevent transmission of HIV to infant through breast milk that is not a breast milk, whereas to give the clean water and affordable replacement feeding, which is infant formula. Now comes the level of preventions. There is primary prevention, secondary, and tertiary. Primary prevention is actually the reduction of risk factors before the occurrence of disease. Secondary prevention is the early detection of potential for development of disease and then early treatment. Tertiary prevention is the treatment of existing symptomatic disease process to ameliorate the effects or delay its prevent or progress. Now comes the primary prevention. Primary prevention includes various the barrier method, various distribution, health education, risk reduction approaches, pre-exposure prophylaxis, post-exposure prophylaxis. Secondary prevention include HIV testing, STD testing, diagnosis, partner services, linkage to care. And the tertiary prevention include engagement and retention in the primary health care and engagement and retention in the treatment. Now comes the primary prevention. Primary prevention means preventing HIV infection through safer sex practices, not sharing needles, abstinence, pre-exposure prophylaxis, and post-exposure prophylaxis. Secondary prevention of HIV include reducing the risk of HIV infection to other people by maximizing the health outcome of person living with HIV, which include antiretroviral treatment to suppress the virus, risk screening and reduction, partner notification, preconception, and perinatal care. In primary prevention, it includes health education, awareness, sterilization of instrument, non-sharing of razors, injection syringes, toothbrushes, screening of HIV in blood or blood products for transmission. Specific protection include chemoprophylaxis with antiretroviral therapy, for example, pre-exposure, post-exposure, preventing mother to childhood transmission. Pre-exposure include combination of oral drugs, which is ampicillin plus tenofovir disoproxil fumarate and M-tricitabine plus tenofovir alpha-numate fumarate can reduce the risk of sexually transmitted disease. And pre-exposure prophylaxis reduce the risk of getting HIV from sexual intercourse by 99% and IV drug by at least 74%. The healthcare provider will prescribe these drugs for HIV prevention in only if you don't already have HIV infection. You will need any HIV test before you start any pre-exposure prophylaxis, and the test should then be done every 3 months for pill or before each injection for as long as you are taking pre-exposure prophylaxis. Post-exposure prophylaxis include first aid care, counseling, risk assessment, and it should be initiated within 72 hours. It includes tenofovir plus lamivudine for 28 days. Follow-up at 3 months with HIV testing is recommended. Vertical or mother to transmission, HIV can pass to offspring through placenta during delivery and breastfeeding. 20 to 25% in absence of intervention. Vertical transmission. Therefore, WHO recommend a first-line regime of antiretroviral for treating pregnant women, prophylactic regime for infant during various stages, antepartum, intrapartum, and postpartum, which gives twice a day for 7 days. To infant and mother twice a day. Scandi prevention include early diagnosis and treatment, and incubation period of this is actually few months to 10 years or even more. Screening of tests for AIDS includes ELISA, which detects the antibodies in the blood, and its sensitivity is the 99%. Another test include the diagnostic test include the Western blot, which detects also the antibody test to viral load, viral code protein P24, and enveloped glycoprotein GP41, and virus isolation. There is also the treatment. These are diagnostic tests, and now treatment of HIV. Antiretroviral therapy is recommended for treatment of HIV, and there is no CD4 cutoff level for starting the AIDS treatment. The antiretroviral drugs are these, which include various nucleoside reverse transcriptase inhibitor, which include zidovudine, adenosine, lamivudine, tenofovir. And non-nucleoside reverse transcriptase inhibitor, which include nevirapine and epavirins, protease inhibitors, ritonavir, and endinavir, lopinavir, and sepanavir. Various also entry inhibitor, CCR5 receptor inhibitor, integrase inhibitor. Various are given. Classification are drugs. And first-line treatment for adult is include 2 nucleoside reverse transcriptase inhibitor plus non-nucleoside reverse transcriptase inhibitor or integrase inhibitor. Routine viral load monitoring at 6, 12, and then every 12 months is recommended, and treatment failure is occur when there is 1,000 copies of viral per ml after 6 months of treatment initiation. Second line treatment IRT for adults include non-nucleoside reverse transcriptase inhibitor plus protease inhibitor drug combination. Tertiary prevention include the HIV-related infection, cotrimoxazole, managing opportunistic infection and cancer related to HIV through treatment. The tuberculosis and HIV infection, tuberculosis and HIV 16 to 27 times more likely to develop active tuberculosis infection. Tuberculosis test can be false negative problems, and there will be problem with drug resistance. Now come the recent updates. WHO response will include the global health sector strategy of HIV from 2016 to 2021. The strategic directions include information to focus action, intervention for impact, covering the range of services needed, delivering for equity, financing for sustainability, innovation acceleration. The United Nations Program on AIDS, UNAIDS, within WHO leads activity on HIV treatment and care, and it includes global health sector strategy on HIV from 2021, global progress on HIV, viral and hepatitis and STD transmission, consolidated HIV strategic information guidelines, global guidance on criteria, assessment of HIV testing services, and antiretroviral therapy disruption in the context of COVID-19. UNAIDS is also a leading global effort to end AIDS on global health agenda by 2030 as a part of Sustainable Development Goal. Sustainable Development Goal, and the various UNAIDS various key area of UNAIDS is 2021 high-level meeting on AIDS, education plus initiative, COVID-19 and HIV, global HIV prevention coalition, global partnership to eliminate stigma and discrimination. The program areas of UNAIDS is AIDS target, AIDS and STDs, children, community mobilization, fast track cities, gender, HIV prevention treatment, human rights, key population, private sector, and AIDS response, social protection and TB, universal health coverage, and the young people. There is also End Inequalities and AIDS Global AIDS Strategy 2021 to 2026, which is a bold new approach to youth and inequalities lens to close the gap that preventing progress towards ending AIDS. These global strategies aim to reduce these inequalities and drive the AIDS epidemic and prioritize people who are not accessing life-saving HIV services. SDGs and AIDS United Nations SDG goal, a core principle of 17 Sustainable Development Goal and AIDS is that no one should be left behind. And the United Nations, including AIDS, work towards entire SDG agenda, which include 10 SDGs. There is also fast track ending the AIDS epidemic by 2030 by UN-AIDS. The fast track include the target include by 2020 from 2020 to 2030 their treatment by 95% people get treatment by 500,000 new infection among adult in 2020 and new infection include 2000 to 2020 and there is zero discrimination among 2020 to 2030. From 500,000 new infection to reduce to 200,000 new infection in 2030. Only of these targets met when we can achieve the next set of goals to end the AIDS by 2030. Means 95% people with people living knowing their HIV status, 95% people who know their status on treatment, and 95% people on treatment with suppressed viral load. These are the fast track system with zero discrimination. And then there is also National AIDS Control Program in Pakistan, which is actually working. The current statistic about the National AIDS Control Program in Pakistan is that the 49,584 HIV new cases, among them 29,626 are on ART and 51 on ART center till December 2021. The National AIDS Control Program is established in 1986 in Pakistan, 87 with a focus of diagnosis of cases that come to hospital, but progressively it began to shift towards community focus since that time. And the government response till date can be divided into 4 phases. In 1987 to 2003, the National AIDS Control Program response shifted from identification of cases through laboratory service and awareness among general population to inclusion of key vulnerable population. From 2003 to 2007, the Declaration of Commitment in 2001 session and in line with NSF1 and Government of Punjab approved the Enhanced AIDS Control Project for 2008 funded by World Bank. And from 2008 to 10, a continuation of Enhanced AIDS Control Program originally reported over 5 years time frame revised following the devolution of Federal Ministry of Health in 2011 to provincial level. And post-devolution 2011 include present provincial AIDS control program and following their provincial strategies, which will be consolidated with a new AIDS control program strategy that will be documented in 2014 in Pakistan. The goal of the National AIDS Control in Pakistan is to prevent a generalized epidemic in Pakistan by containing the spread of HIV and AIDS and elimination of stigma and discrimination. Its objective include prevention of HIV, safe blood transfusion, reduction of STDs, establishment of surveillance, reduce stigma, training HIV health staff, research and behavioral studies, development of program management, create an enabling environment, build and right capacity, and strengthen the institutional framework. The article is published meta-analysis, epidemiology and outcome of COVID-19 in HIV infected patient and systematic review and meta-analysis. This article said that the data were set from reporting COVID-19 attacks and mortality rate in people living with HIV compared to HIV inactive counterparts. Pooled attack rate and mortality rate were quantified. They identified 22 studies and from various North America, Africa, Europe, and Asia. The median age was 56 years and 50% were male. HIV positive person had significantly high risk of COVID-19 and mortality from COVID-19 than HIV negative. The beneficial effect of tenofovir and protease inhibitor in reducing the risk of COVID-19 and death from COVID-19 in people living with AIDS will remain inconclusive in this systematic review. HIV will remain a significant risk factor for acquiring COVID-19 infection and associated with high risk of mortality from COVID-19. In support of this guideline, CDC guideline, person with HIV need priority consideration for COVID-19 vaccine according to this systematic review. Another article is antigenic variability obstacles on the road to vaccine against traditionally difficult targets. Despite the impressive impact of vaccine on public health, the success of vaccine targeting many important pathogens has been limited. And the common feature of important pathogens such as HIV, hepatitis C, dengue virus, influenza virus, Ebola virus, Plasmodium species, and cancer cell is the antigenic variability, which were caused by high mutation rate and genetic instability, which in turn represent an obstacle for development of these effective vaccine according to this study. And this review highlights the most critical common issues related to the development of vaccine, many pathogen and cancer that escape protective immune response owing to antigenic variation, and which is major obstacle by applying, and therefore we can overcome the obstacle by applying international alternative approaches for rational design of new type of immunogenes. There is also another study which is actually HIV outbreaks in Pakistan, study published in Lancet in 2019, which said that HIV prevalence among general population is estimated to be less than 0.1%. But HIV epidemic in Pakistan is currently in key population is concentrated type, and key population include most common in inject IV drug abusers 38%, male sex worker 5%, and female sex worker 2%, transgender sex worker 7%. Now time for MCQs. MCQs 1. Transmission of HIV or AIDS refers to transfer of HIV from person to person. HIV can only be acquired or transmitted to specified activities such as alpha, breathing in infected droplets, beta, mosquito, tick or insect bites, C, shaking hand, delta, sharing cloth, E, sharing needles. The question is HIV can only be acquired or transmitted to which type of activities? E will be the correct option, that HIV can be transmitted through sharing needles. It cannot be transmitted through mosquito, ticks or insect, shaking hand, shaking cloth or breathing in the infected droplets. MCQs 2. HIV epidemic in Pakistan is affecting critical communities including person who inject drugs, men, women and transgender sex worker. Pakistan is in which stage of AIDS epidemic? Alpha, concentrated epidemic; beta, generalized epidemic; C, low level of epidemic; delta, high level epidemic; or E,
A.
D.
Alpha. Yes, alpha is correct answer, concentrated epidemic. MCQs 3. There is currently no cure for AIDS. However, drugs are successful in combating HIV and associated consequences. Treatments are intended to minimize the amount of HIV in body, keeping immune system as healthy as possible, and lessen the number of issues you can develop. The treatment of AIDS is started at CD4 level: alpha 200, beta 500, C 900, delta 400, E no cutoff.
Delta.
D. Delta. D.
With the correct solution, I already mentioned in my slide that there is no cutoff level CD4 for starting the AIDS treatment. Therefore, E will be the correct option, no cutoff. MCQs 4. 32 years old female present to hospital emergency with 2 weeks history of fever, headache, sore throat, painful swelling in neck and muscle ache. He recently traveled to South Africa and requesting a ELISA test, which is most likely cause of this condition: alpha, dengue; beta, HIV or AIDS; C, malaria; delta, measles; or E, tuberculosis.
B.
Beta will be the correct option, HIV or AIDS. During pregnancy, childbirth, or breastfeeding, an HIV positive mother might transmit the infection to her kid. Which of the following is most effective technique for preventing mother to child transmission in developing countries? Alpha, antiretroviral therapy; beta, contraindication of breastfeeding; C, elective C-section; delta, emergency C-section; E, immunoglobulin to mother during pregnancy.
B.
Although all strategies are is to be recommended, but the most effective strategy in developing country from perinatal transmission include antiretroviral therapy. Alpha will be the correct option. MCQ 6, a 47 years old lady appeared with temperature of 103 degree Fahrenheit, non-productive common dyspnea that had persisted for 1 week. She was diagnosed with HIV years ago and CD4 cell count was 583 at that time. Zidovudine was prescribed, but she discontinued it after 1 month and did not return to doctor after a checkup. She suffered from anorexia and lost pounds in weight in the last 3 weeks. The most likely cause of this condition is alpha candidiasis, beta Cryptococcus meningitis, CMV, Delta pneumococcus pneumocystitis pneumonia, or E. toxoplasmosis.
D.
Delta will be the correct option as the woman has HIV and now she developed a complication of pneumonia, which is include non-productive partner dyspnea, and this is the Delta will be the correct option. MCQ 7. In ABC country, about 15% of HIV infected people are ignorant of their illness, resulting in severe morbidity and danger of additional transmission to others. Which of the following is best screening test for HIV or AIDS in this country? Alpha antibody detection, beta antigen detection, C CD4 cell count, with delta complete blood count, E nucleic acid detection.
C.
Alpha will be the correct option, as I already mentioned that the antibody detection is the most best screening test for AIDS or HIV in any country for detection or screening. MCQ 8. If left untreated, HIV usually progresses to AIDS in 8 to 10 years. When any person gets AIDS, immune system is already compromised. The person has AIDS when one of these occurs. CD4 cell count less than 200, beta less than 400, C less than 500, delta less than 600, E less than 300.
B.
B is very common answer that AIDS, and I already mentioned that AIDS is 12 when person has CD4 count less than 200. MCQs 9. A 45 years old man presented with temperature of 103 degree Fahrenheit, burning pain, altered taste sensation, and difficult swelling. For the last 2 months, he had poor oral intake and lost weight. His CD4 cell count was 340 at the time of his HIV diagnosis 2 years ago. He was prescribed antiretroviral medicine, but after 6 years, he stopped taking it and did not return to doctor for checkup. The most common cause of this ailment is alpha candidiasis, beta cryptococcus meningitis, C. CMV, delta pneumocystitis pneumonia, or E. toxoplasmosis.
A.
A.
Alpha will be the correct option, as I already mentioned that the patient is diagnosed case of HIV and he has already prescribed antiretroviral therapy, but he is non-compliant and did not return to doctor, and now he develops the complication of candida infection of mouth, oral thrush, and the most common symptoms include altered taste sensation, difficult swelling, or burning pain. Therefore, the correct option will be the alpha candidiasis or oral thrush. MCQ 10. An HIV vaccine is potentially vaccine that could be either preventative or therapeutic if it would become either meaning it could either protect people from getting HIV or treat people who already have. But currently there is no vaccine HIV because of the following reasons: alpha biological or chemical physical cost to inhibit the virus is more effective strategy. Beta latency can abrogate any vaccination effect. C. Such vaccination could be too expensive. Delta virus can be controlled by change in personal habit. E. Virus is so antigenically variable.
B.
D.
E will be the correct option, as I already mentioned recent advances that various infections like hepatitis vaccine, HIV vaccine, and various other virus vaccine is still under trial, but there is no approved vaccine because the virus of AIDS is so antigenically variable and mutation can occur. Currently there is no vaccine available till now for AIDS or HIV. Therefore, E will be the correct option. This is the key of my MCQs. And thank you.
Thank you very much, Dr. Hansa. Very nice presentation. and you have covered your time with a lot of information. You are doing a lot of research on HIV. You have many publications related to HIV, and your knowledge has been beautifully translated into your presentation. You have shown one of a very important criteria that CD4 count when they are less than 200, HIV is declared as developed into AIDS. Because we know that AIDS is also known as a slim disease, and it is one of the fatal illness caused by a retrovirus, and all the HIV patients who are having the retrovirus, that is human immunodeficiency virus, may not lead to AIDS. The immune system disorders, especially when HIV infection or AIDS are considered, we are looking forward to the gradual depletion in a specialized group of white blood cells, that are the T cells or T4 cells, and the CD4 count is very important in this case, as HIV selectively infects T helper cells apart from several other cells in the immune system, such as B cells, macrophages, and nerve cells. But the most important criteria is always the destruction of the T helper cells. So the people who are with AIDS tend to have low overall white blood cell count, whereas the healthy individuals have twice as many helper cells or suppressor cells, while in the AIDS patient the ratio is also reversed. So the ratio is also very important, and the decreased ratio of the T helper or the T suppressor cells is the indirect indicator that this patient is going to develop AIDS while they are having HIV positive status. So there is still lack of any obvious immunological response by the host to the